Now, Tennessee recently enacted drug tests for welfare recipients in a way of cutting down on, people who are on drugs and just using their welfare money to buy more drugs. So they initiated this public assistance program, or this public assistance drug testing program. Anybody who applies for public assistance for welfare has to get drug tested in Tennessee. And they initiated this in the hopes that they could save money. I think we all know where this has been, where this has gone, or where this is going, because we know where this has gone in other states. It has been a complete fail. The results of this drug testing, after looking at it for 6 months, looking how many people were found using drugs and kicked off the rolls, it equated to less than 0.5% of people applying for public assistance failed a drug test. Huh. Out of more than 16,000 applicants from the beginning of July to the end of 2014, according to state data, just 37 tested positive for drug use. Now that's about 13% of the 13% of the 279 applicants who the state decided to test based on their answers to a written questionnaire about drug use. The overall rate among applicants is 0.2%. How much did it cost? It cost quite a bit. For example, Utah. Now they don't have figures for Tennessee yet. But in Utah, they did the same thing. And they spent about $30,000. That caught 12 people. For once again, a rate of 0.2%. Compared to the 6% of all state residents who use drugs. Florida, same thing. They had a 2% drug use rating among public assistance users compared to 8% of its total population. It's one of those things where math, right? You have to look at the math. And the math says that people on public assistance do drugs and alcohol at a much lower level than everyone else, than people who are not on public assistance. You know why? My guess is that they're too busy trying to buy food and pay their bills. I know, shocking, right? That you get money to pay bills. And you use it to pay bills to keep a roof over your head instead of doing crack. But see, this goes back to the perception that people have of other people on welfare. They're lazy, they're on drugs, and they want free money. Which actually, a lot of conservatives don't know. Welfare, you have to work to get welfare. There are work requirements. There are a lot of work requirements for a lot of public assistance programs, including food stamps. And a lot of places still have waivers. They're still on waivers because of the bad economy, but there are a lot of places where those waivers are ending, and you have to have some sort of work requirement or searching for work in order to qualify for food assistance. It's just one of those things. But no, conservatives act like if you're getting welfare, that you're not working for it. And what's funny is that they kind of counteracted that during the election by saying, oh, look at that. See, Obama waiving the work requirement. He wants people to go back to just collecting their welfare check. No, Obama was actually issuing more waivers. Because of the bad economy, the same thing that he was doing with food stamps. According to data, less than 4% of welfare recipients have a drug abuse problem. The kind of habitual dependence on a drug tests are theoretically designed to root out. And the rate of non-abusive drug use among the welfare population is barely above that of comparable non-welfare families. According to the data, other physical and mental health problems are far more prevalent among low-income people than substance abuse problems. Perhaps that's because A lot of people on welfare and on assistance programs are disabled, or they're veterans, or they have other issues. And so that's why they need the social safety net. But no. The general public and legislatures continue to think that if you are on welfare and you must be either on drugs or lazy. And that we need to drug test you to make sure that you're not spending hard-earned tax money on crack or meth. Once again, it's another way to try and shame the poor.